Welcome to MasterMined, the behavioral health business podcast. We go beyond the clinical to explore what it really takes to build, grow, and lead a successful behavioral health organization. Each episode features candid, practical conversations with industry leaders, offering strategies to scale your business while staying true to your mission. From branding and marketing to leadership, culture, and compliance, we cover the tools you need to balance care and commerce with confidence. MasterMined is brought to you by Snapshot, a digital agency on a mission to serve with heart, execute with excellence, and build something bigger together. And now, welcome to MasterMined.
Today, we're digging into one of the most underused growth opportunities in the treatment world, your alumni network. A solid alumni program isn't just a feel-good initiative. It's a long-term business asset. But let's be honest, it takes real work to activate that community and keep it engaged. In this episode, we're breaking down what it actually takes to build something meaningful, why most centers underestimate the effort, and how the return on brand, on reputation, and on outcome is well worth it. Lee, Jeff, welcome to the episode.
Thank you, Mark.
Great to have you guys today.
Thank you very much.
Yeah, so let's just get this one kicked off. I know you guys feel very strongly about this topic, and this is going to be a great episode. Really looking forward to it. What is the cost of not having an alumni program in this space, and where do you see that showing up the most?
I would approach that answer probably two different ways. Okay. So the question is, what's the cost of not having it? For a lot of programs that have a robust and effective alumni program, it can mean as many as 30% of their admissions. And that doesn't just mean alumni coming back to their program. What that means is that they've had a good experience and they've shared that information with people that they know and that they've recommended the program. So, if you think about marketing in any other industry, we talk about how we want to generate raving fans. And if you think about it, if you've done your program well and your program is effective, you have generated raving fans. Why wouldn't you want to stay engaged with them? Why wouldn't you want to incentivize them to tell more people about what you do?
Yeah, I totally agree with you, Jeff. I think for the way that I approach it when I'm talking with programs that maybe don't have a robust alumni program, it's when you graduate and you can get somebody signed up to your alumni program, it's going to enhance their opportunity for lifetime sobriety. And then you have to also speak the CFO language, and you have to understand the lifetime value, right, of that patient. And that's where you can where both can kind of come together synergistically, and we can support the real world financial needs of your center, but we're also serving those real world needs of your client, right, of your patient. And that's where I think the alumni programs can really come together, and people feel good about investing and spending that money, where sometimes we don't always feel good about why do we have to spend money on paid search as an example, but we can really feel good about the investment. And it just because it's alumni, it still has to be tracked. That's the other part that I see a lot. It's like we'll say we have an alumni program, but then we really don't track and understand like what is that feedback loop, because there has to be the feedback loop, or you're never going to get the investment that you need, from the financial side of the business.
Yeah, great points, guys. And Jeff, I liked how you spun that of like a successful alumni program contributes 30%. And that's an amazing stat. Let's just say I'm building this thing from scratch, an alumni program. Mm-hmm. Is there a first hire or a system that I need to integrate into my center to make this successful?
Well, one of the first things that I look at when I start looking at programs that are interested in alumni, I look around and see who's currently employed at that center, and I'm looking to see, is there anyone that's on this staff that has already successfully gone through this program, and then they are professionally successful in their role, and that tends to be, from my perspective, one of the best ways to actually start building some inertia around an alumni program. So someone who has gone through that program, who's professionally successful, and can start to generate a little bit of momentum around them, and then also who's got the people skills to start generating those relationships while people are in your program, and then staying in touch, after they've left. Chances are you have one or two people that are already employed in your organization that could be deployed in this way if you just take a look at some of these, basic people skills.
Especially if you surround them with some scaffolding of professional development. And there's TPAS, professional organization that supports alumni in our industry, that would be very helpful. And then there's going to be other, centers in your area. There's going to be other professionals right around the country that can provide that scaffolding and lean in and really help bring that person to becoming a professional, alumni coordinator.
Yeah, and we all see it. I mean, they all have a Facebook page and a Facebook group dedicated to alumni. Maybe you guys, if you could break it down on why it's just so much more than just that. Lee, how about?
Well, yeah, Mark, I think Jeff alluded to this. When you're talking about alumni program, there are two branches to that. There is the piece that we want to make sure that we're in touch and connected to the folks that graduate our program. So if there is a reoccurrence, that they think of us to come back first. Mm-hmm. That's one part of it. The second part is that we want to make sure that we've got that person involved in our program, which could also participate in research. We always talk about evidence-based.
Right.
Well, how do you get people involved in actually providing you the evidence? Well, you have to have some research component, and alumni can help them stay connected. But then it's also the family, right? It's the friends and family that should be invited and a part of this alumni program too. That's where you get this force multiplication that you've heard me talk about a lot. That's where all of a sudden your alumni program really starts to grow, and you will get referrals back if you're doing the hard work, the good work.
Yeah. Jeff, how about?
Yeah, I mean, I look at it from sort of a community building perspective. I mean, to pick up from where Lee is. So if you're running a successful program and people are finding success and then graduating and they're going back to a home life, they're going back to a professional life, they're getting back to function, they're getting back to contributing. What you're doing is you're building, one person at a time, this robust community that you can continue to support, right? The challenge that a lot of programs have is that they're always looking for new people to then come through that program, when the reality of it is you need to be nurturing both. You need to be nurturing the front end of your program, and you need to be nurturing the back end of the program, so that not only are they getting support after going through the program, those are also relationships that people can have for the rest of their lives. Mm-hmm. I mean, some of the most valuable relationships people develop while they go through a program. So if you can support that, why wouldn't you be the first program that gets recommended when someone needs help?
Yeah, let's stay with you on this one, Jeff. But just, hey, we're starting out, we're building our alumni program. What does activation really look like in this space? And then, how long should I expect it to take?
Well, I think it's really important that you develop some criteria straight out of the gate, and before you start start inviting people to this and doing that and creating a Facebook group, and it's like that comes next. I think the first thing that you want to develop are some guidelines in terms of who might qualify to be in this alumni group. So, did they successfully complete the program? Did they not successfully complete the program? Do you have any sort of criteria about how, what kind of length of sobriety they need to have, or they need to show some stability or some progress beyond your program so that they can then continue to bring a positive influence back? So once you establish some basic guidelines, and that'll vary from program to program, you need to identify who is going to be sort of a point person for that program, because again, this is a relational situation. And so people connect to people, not to programs, right? So the person that is going to be responsible for this and be the point person, that needs to be an easy person to contact via phone or text message, or and create the tools so that it's easy for alumni to engage. So you mentioned the Facebook group, that's one tool. But I mean, there are other technologies out there, apps and things like that can also be equally valuable to collect data, keep people engaged, and also keep them safe and supported.
Mm-hmm.
Yeah, I think that a lot of times we will start with this big idea of an alumni program, and all of a sudden it kind of gets unwieldy. And I think that you have to start with the very basics. Are you talking about the alumni program? Do you have something documented that you can talk about while the patients or your clients are in treatment, so that when they get ready to discharge, that you've got an opportunity to get them committed to joining your program? And part of that is, it can't just be XYZ Center alumni program. All right, that doesn't sound too exciting to me. There needs to be some more thought process put into the branding of what your alumni program is going to be. And then what are they getting out of it? Because meetings are a part of it, but sometimes we've got a lot of meetings. Most people are going to multiple meetings a week, if not a meeting every day early on. So adding another alumni meeting. So you have to challenge and say, what are some other offerings that we're going to bring to the table outside of a meeting? And that's where you start to get into some interesting things like, are you going to have a picnic? Are you going to have a closed Facebook group? Are we going to have, a coffee? There's different things to kind of connect and reach, and it's going to be different for every center. But that's where you kind of have to start, and it doesn't have to be a super expensive thing. Right? It's going to start, and then as you start to grow, and all of a sudden you've got 10 people involved, 50 people involved, and then 500 people involved, then all of a sudden you should be able to take the referrals that you're starting to get back and reinvest that, because they're not just free. A lot of people think I will set up an alumni program, it's going to be free, and it's going to be my lowest cost per admit. It will generally be your lowest cost per admit, but it's not free. And the great thing is, I think most centers that I speak to, they would rather invest that money in their own people and the loved ones that help support them than just running more paid search campaigns, as an example.
Yeah, I mean, Lee makes a great point. I mean, quality alumni programs literally start the day of admission. So actually having identified how those resources are going to work and those relationships are going to be developed while someone is in your program, there's already a warm feeling about what it's going to be after they graduate. You're developing a positive momentum with somebody when they're maybe at their lowest point. And so you give them hope in terms of, here's what the community looks like after you graduate. And another thing that Lee touched upon, the opportunities are literally endless in terms of how you want to engage this population. So, like, for example, if you're in the young adult space, for example, this might be a fitness oriented, or it might, it's like the various activities that can be enjoyed. In a safe and friendly environment. These could be book clubs. These could be movie clubs. I mean, it's like it can literally be branded and developed to fit your profile and to fit what you're going for. So, because a lot of people, when they find sobriety or they're dealing with a mental health challenge, they're really not sure what life looks like on the other side of actually going through a program. And so by giving them a window in terms of what's possible, and you see people having fun, and you see people really enjoying the community, then it's like that's another momentum builder to say, hey, I see what the future can be.
Jeff, do you remember, this is going back a few years,
yeah,
but it was one of the things that I think I was most proud from our alumni program, and we had a great Sabrina Mathis was our alumni coordinator, but at Foundations. And what was so amazing was we came up with this idea of, let's create an essay contest where the children of alumni can write an essay and earn a 500, 1,000, and I think 2,500 was the top. Scholarship.
Yeah.
Now, it doesn't pay for the full thing. And that's the kind of interesting thing that a lot of places would be like, well, I can't spend that money. But oh my goodness, I want to say we got 70 or 80 essays.
Oh yeah.
Like it was, I remember we were like, oh my gosh, we got to get some more people on the committee. Who's going to read all these essays? But that's the kind of interesting engagement that not a lot of people would think about. But when you have an alumni coordinator, they can start brainstorming more. Like there's so many other things available. And that's where, you eventually get into supporting the community, whether it's doing a run walk, and maybe not organizing, but participating in. And I remember we used to do stuff with, what was that group in Colorado, Phoenix?
Yeah.
I forgot the guy's name, Scott. He was like a CNN hero, but we started promoting that. There's so many different ways, and that's what people really go, oh, I want to join your alumni program, versus just, okay, well, what's the alumni program going to do for me? Oh, well, we have a meeting. Okay, that's part of it, but you need more.
Well, I mean, Lee brings up a great point. Yes, I do fondly remember that, because we took a chance in creating that opportunity, and we're literally blown away with the responses that we got. And then the depth of feeling, and then what came back in those essays was, I mean, it's like, it shows you why you want to invest in this program, because you are literally changing lives. I mean, so that just reminds me that a lot of alumni programs focus on the person who's going through treatment or the person who's going through a program, when the reality of it is, it's like, we're talking about parents, we're talking about grandparents, we're talking about children, cousins. I mean, the entire, when one person goes to treatment, their entire network is going through treatment. So to the extent that you can engage those additional people into your alumni program, I mean, I'm aware of, certain adolescent programs where moms in particular have banded together, and they've created their own Facebook groups, and they've gone on to do some just incredible advocacy work that has influenced legislation, that's influenced policy, and it's all as a result of them being in a basically an alumni group where their children went through treatment. They met each other through support, and what they've managed to do is just insanely powerful.
Yeah, I love this conversation, guys, and I'm going to put you on the spot for just a second.
All
So
right.
maybe think about it. But was there a nugget that you took out of one of those essays that really stuck with you of how powerful this thing was?
Well, I think for me, the power was the volume of children that were willing to write about something so personal of their parents, right, that went through recovery, and how that positively impacted their family. I mean, that's what I couldn't believe, the volume. Like when we had this idea, and then Sabrina and the team put it out there that it was available. I mean, we were kind of thinking, oh, we'll get 5 or 10.
Yeah.
And the volume was like, whoa. I mean, people were willing to share. I mean, the children were willing to share, and that's where people have to think bigger about alumni. It's not just the patient. Like that starts there, but you have to bring in. And again, not every family is going to participate, so I understand. But there's going to be family and friends that also want to help. So when you're thinking about building your alumni program, there's going to be certain touch points within that program that are appropriate for families and loved ones. But there's going to be certain touch points that are only appropriate for the client. But it's all part of this alumni ecosystem that I think is really important. I think back in the day, I don't know how they are now, but back in the day, Betty Ford was like one of the leaders when it came to alumni programs. They were very active, in multiple communities. And I used to hear stories from like John Southworth and stuff that that Dr. Harry would say like 40% of their admissions were coming from alumni, and I can believe it. But it's because they actually invested. It wasn't just it's not just free. And when you look at universities and private schools especially, they have very robust alumni programs. It's not because they're just doing it completely altruistically. They're doing it because they are staying connected with those alumni who are then participating back, probably donating money,
Right.
and then also ensuring that their children come back to that school.
Totally.
So there's some things that we can learn from other industries who have alumni type programs. Same thing with probably like automobile. I think that's something that we've always looked at. When you become fans, super fans, as you mentioned,
Raving fans.
and then how do we turn our patients and our clients, into people? It's not for everybody, but you want to have those opportunities available to be that ambassador.
Yeah. Well, let's keep going down this path, Lee. You brought it up about events, and maybe what's one common problem that you see when centers put together events?
Well,
how do we?
Can we actually,
Yeah.
before we go to events?
Yeah.
Lee brought up something that I want to jump on.
Okay.
So, sorry,
Go
correct
ahead.
you, Mark, but I just want to jump on this. One of the things that I took away from that essay situation, and I've just seen it validated more and more in the years since, a lot of programs and a lot of decision makers at programs, they self-select thinking, oh, people won't want to do that. Or it's like, we're asking people to be too vulnerable. And it's like, we, the decision makers, sometimes think that there's a stigma that's overlaying all of this stuff, and they're like, people go through treatment and then they want to forget about it. They don't want to talk about it anymore. It's like that's now in the past. Well, what that essay story taught me, and it's only gotten stronger years ahead, is please do not predetermine what people will or won't do, because what I've seen more often now is that it used to be the thought that people were ashamed if someone went to mental health treatment or a substance use treatment. Now it's actually a sense of pride. I went to a high school graduation event, and one of the valedictory speeches that was given, they actually spoke about their father, who was their hero, who went through addiction treatment while he was in high school. And I'm kind of tearing up thinking about this, because there are people who own programs that think no child would want to talk about that. And it was just incredibly powerful for him to stand up there and say that, my dad is my hero and look what he's done. And I hope that I can only be half the person that he is. So it's like that speaks to this deep well of goodwill and forward momentum that if you can tap into that, that's the legacy that you literally can't buy.
Yeah.
And, Mark, I was going to say, a lot of times when I have worked with different clients and we'll talk about alumni, I will ask them, how many people have graduated your program? And they don't know that number off the top of their head like you would think they would. Because, lots of other industries can tell you how many cars were sold, how many students graduated, like they know it. But in our space, sometimes we don't know it. And so that's one of the first things to do is to understand how many people have graduated your program, then how many people are in your alumni program, and then we'll get some number. Yep. And then I want to know, are you measuring the engagement of that group? And a lot of times they're not. And they're wondering, they'll tell me, well, we tried it, it didn't work. And I'm like, well, again, I think maybe you weren't really, you hadn't figured out what your patient, your alumni wanted right out of the program. Because maybe some people want a meeting, maybe some people want to go to a 5K, maybe some people want to do an essay, maybe some people want to do a trivia night. You have to understand and then start to measure it. And a lot of times we're afraid to measure it, right? Because we're like, oh, well, Lee over here, he graduated and he's really trying. And there's nothing wrong with that. That's why we keep coming back to, I say, you got to build some scaffolding for them. Right. They need to have some professional development so that they can start to really expand the opportunity. Yeah.
Well, and that's where there's some technologies that can help you in terms of, like, for example, let's just use your hypothetical, let's say that Lee graduated the program, and for the first 90 days, he was very engaged. For the first 90 days, he responded to emails. For the first 90 days, he answered our calls. But then for the next 90 days, all of a sudden, we start to see this trailing off. And we're like, okay, so we can take that as a data point, or we could actually do something different to engage Lee and say, well, we noticed that you used to be really excited. And then maybe it has nothing to do with your alumni program, and it has to do with they're going through a tough time. But the data will point that out. And so then you can look at these, these patterns and then decide what interventions are actually important. So this is not just kind of a gut feel. I mean, there are tools and data that can tell you kind of what's going on with the organization. And then there's the human intel part that just says, hey, we tried trivia night. How did it go? Don't be afraid to send the survey. And also, if somebody gives you ones across the board that your event was absolutely terrible, they're trying to tell you something, so it's like, maybe dig a little deeper in terms of what's going on. Yeah. Or if you get all fives and you get that one outlier, you need to be smart about how you use the data to decide what's working, what's not working.
Yeah.
And, again, Mark, sorry, we're going to let you get to your question here in a minute, Mark.
No.
I was thinking, I've been working on a new keynote presentation for this year. And one of the main threads that runs through that is alumni. And I share the story of Suzanne Johnson, who is very, I think, well known in our industry. She became an interventionist after she came through treatment, and how she stayed in touch with us through our alumni program, and she was in touch, and she came back to Nashville to go find Brandon Wharton, who was the person that took her call the very first time. And it was that connection. And through that, Suzanne, she stayed in touch, became an interventionist, and she would come to our conferences. She became one of our original heroes with our Heroes in Recovery program and was an advocate. I mean, that was amazing. All the people's lives that she touched, not just even thinking about that she was so positive and provided a lot of great content and referrals back to us. She also just touched so many lives, and we were there to support it. And it wouldn't have happened if we hadn't invested a few dollars in kind of building out this program.
Yeah, I'm so glad that you cut me off, Jeff, on this. That was an amazing story. And I'm so glad you were able to tell it, because it was very, very powerful. And I guess, just tracking along like this path, like what do you talked about events and putting together events to keep the alumni engaged. I guess do you ever see problems like or challenges that centers face when they're putting these together? What's a common mistake they make, and how do they put together events that are going to keep the alumni more engaged?
I think where I see the problem is things are not scheduled well in advance, and I see that even outside of alumni. I believe that you can set up kind of your plan for the year, and it should be well in advance, because that's what you're going to communicate to the folks that are coming into your program. And it's really key to connect this alumni program all the way through your program and to admissions. The person who is on the phone sharing the story about your treatment center, they need to also talk about, and what's going to be amazing is that when your son or daughter graduates our program, where they're going to be connected with other like-minded individuals who have joined and connected in our alumni community. Like all of a sudden you're taking that continuum of care all the way through, and they start to see a much longer vision than typically what happens, where people just they leave the program and they go back to their home state, and then they wonder well, what happened? Where's that support? And so I think it's really critical, and it helps with giving your admissions team something else to focus on and share that's so positive. So, but I think where I see the fallback is that we become last minute. Oh my gosh, it's May. It's getting ready to be May 1st, and I need an event for June. Yeah, I haven't organized this, and so it's like, no, just go ahead and set it all up. If you're going to do a trivia night on Tuesdays at this place, go ahead and set it up. And then let the challenge be turning people out, right? And that's where you start to figure out your different touch points and your engagement points.
Yeah, what I've seen be really effective, just to bounce off of what Lee has said, just generally speaking, people thrive on structure. And programs really thrive on structure. So I would encourage people to think about sort of structuring it like this. So like come up with what I call a tent pole event. Okay, so that might be a homecoming, for example, where you
or like the Cumberland Heights picnic.
Right, exactly.
They do it every year.
So it's like you need to come up with an annual tentpole event. That could be a golf tournament. That could be a frisbee tournament. I mean, it should fit your personality, right? But there should be one tentpole event where everybody knows it's going to happen this time of year, and it just becomes something that you can count on. Then I would recommend some like smaller events that you do quarterly. Right? Again, where people can count on it. And then
some online, some offline.
Right, exactly. Yeah. So some online, some offline. But again, the cadence is really important, where it just becomes, it's Alumni Thursday. And it's like, the third Thursday of, every third month, for example, you can just count on something happening, right? And then peppering around, I would say quarterly in terms of like trying to turn people out. But then it's all of the stuff that's kind of in between in terms of the phone calls, the text messages, the maintenance of the relationships, if you will.
The emails, the app connection. Yeah.
Right. I think that is a great way to start in terms of just creating a structure. And then once you establish that structure, you need to go ahead and, like Lee said, a year in advance. You already know what to count on. You can reserve the place for the picnic. You can go ahead and say that, every other quarter is going to be online. Every other quarter is going to be physically in person. And here's what it's going to be and where we're going to do it. You can pre-write those emails.
And when your discharge planner is meeting with the patient as they're getting ready to discharge, they've got something to really show them versus what I hear a lot.
Right.
We'll have our alumni coordinator get in touch with you when you get back home. The conversion rate's not that good on those. It's better to go ahead and just give them the whole packet. Cumberland Heights has done a great job. Nick and them created this swag box for their staff, like when they're first hired. And we're doing the same thing, because at Foundations we had a Heroes box. So when you graduated our program, you got a Heroes box, and it was part of our ceremony. And I think that when you can make it formal like that, and you get people excited, and you do it right there versus waiting to get them signed up later, maybe after they've gotten home, it's so much more impactful.
Well, and then just again with just human nature, if you tell somebody something's going to happen and it doesn't, then you've actually gone in reverse in terms of building trust. So that's why that structure is so important. So that you say that it's like, okay, you're going to get a phone call from us within the first 10 days of going home, or you're going to hear from us 30, 60, 90. You need to do that, because in the back of their mind, they're like, well, they said they were going to, and it's like, and unfortunately it's kind of like, do they really care about me? It's not just they didn't follow through. It becomes this really sort of collapsing situation where it is just like, wow, okay, I went through treatment and I'm not having a great day, but can I really count on them? That's the really negative side of that. Mm-hmm. But imagine what you can do on the positive side of that, where you do follow through and you actually exceed their expectations. Then all of a sudden they're like, wow, that was way better than I expected. Yeah. That's how you develop and build a raving fan.
Yeah. Lee, you brought up the swag boxes, but I'll open this up to either one of y'all. Like, have you seen other things beyond that maybe create a real meaningful connection with alumni? Is it ceremonies, coins?
I think what Jeff was alluding to with the annual event, the tentpole event, I've seen it at Cumberland Heights firsthand with their alumni picnic. It's amazing. And I think also there's going to be a certain percentage of your alumni that over time want to become whatever you want to brand, a brand ambassador. We call them advocates, at foundations. And all of a sudden, we all know people in different cities that we know if we called, they would step in and help. But formalizing that, yep. I think really they get some pride. And then again, when your discharge planners are speaking with your patients that are leaving, they can actually know it. At the right point, I want to connect you with Susie, who's in Spokane. And I think that, you make a good connection, at the right time. I mean, all of a sudden that really just becomes so meaningful. Because it's the meaningful contact. A lot of times we get stuck in just doing kind of the rote stuff, but it's like, wow, alumni is a really good opportunity to really continue that meaningful impact that they've obviously had meaningful impact while they're at your facility for the 30, 60, 90 days. But it's what happens when they get discharged, and you can keep that meaningful impact going in an alumni program.
Yeah, you both talked about like calls and how important they are and what cadence, but what are you seeing from newsletters? Is there any meaningful content or messaging that a center should think about to keep the alumni program engaged?
I was going to jump in here. There's a number of phases to building an alumni program, and the last phase is return the favor. And that's where you can set up a system, whether it's a special number or whether it's a special person in your admissions team, that you can tell your alumni team, hey, if you need a private confidential referral, you can call Lee, and they're specially trained to work with our alumni. I mean, those are the kind of things that successful programs, you don't have to. The return the favor is not at the beginning. You have to build the trust, right, and earn the trust. The return the favor is a little bit later down that funnel, but that's where people do want to refer back to the places and the specific people. You said it right, Jeff. They want to know that my therapist was amazing, or my discharge planner, or like in the example of the guest house, they call their staff the OGs, the original guest. I mean, that's where it really makes a profound difference, in what you're building.
Yeah, I mean, I'll just state it again. People refer to people, not programs. And so developing that relationship with somebody, like Lee said, having a go-to person on the admissions team, having a go-to person that they're used to speaking to Mark on the phone, or they're getting text messages from Mark. Even if you automate those communications and then you set up a phone call, it needs to feel personal. Mm-hmm. It needs to come from a real person. And the other thing too that hopefully goes without saying, you need to be tracking that in a CRM or a database, just like you would anything else, so that when they do call Lee on the admissions team, they've got an idea of how involved this person has been and how many communications we've had with that person and what kind of engagement they've had and what's going. The more data that you have when that person calls, the more supportive you can be and just say, well, okay, I see that it's been about four or 5 weeks since we've been in touch with you. How have things been going? And again, this is a very warm on-ramp. If you've maintained the relationship and they have a personal connection, this should be a very warm and caring engagement.
Yeah. Well, I don't want to miss the opportunity to let the listeners know to please drop in any like questions you've got or comments into the comments section so we can cover it on another episode. But here's one that came from a past episode that I want to throw out to you. So let's just say I'm a program and I've been doing it for 3 to 5 years, and I have a decent size growing alumni network, but in comparison to, you mentioned Cumberland Heights, they've been doing it for a long, long time, big alumni network. Like, how do I think about the alumni network and building it for scale without like losing all that intentionality and keeping it real tight knit?
Well, I think that's where, most of the programs that I've worked with, we've built it over time. Like, we didn't come in and create a 10-person alumni team day one, like you build it. And I think that if you'll approach it that way and also not be afraid to let your alumni provide some feedback and some leadership. That's where we had advocates, and we sent them through a training program. And I think that's a critical piece, because when you're growing an alumni program, your staff is not always going to be able to cover everything. So maybe some of the events are actually run by the alumni or the advocates themselves. And that's part of the giving back that I think is of everybody's nature in this business. And so I think you have to be open and then utilize those talents that they may have.
Yeah, I mean, Mark, I would bounce off of what Lee said, and you do need to begin with the end in mind. Okay, so even if you're starting small right now, you still need to be thinking about, I'm going to be doing this 5 more years from now. What do I want that program to look like? And then start to build the structure of what that's going to be 5 years in the future. Maybe, at 3 to 5 years, you go ahead and decide what is that tentpole event going to be. And maybe you only do one of those, but you really focus on, doing that and executing that extremely well. And then also identifying who are your key people. They may be part-time, they may be employed by you, they may be outside contractors, but putting the power back into the hands of the people that are going to benefit the most, that's where you're probably going to get the most traction.
Yeah. How do you see like alumni stepping into like the marketing and the referrals and the program still keeping it like ethically like done? I mean,
there are 2 areas that are immediate. One are testimonials that they can share, and then positive reviews that they can offer about a program. And I'm continually amazed at the number of programs that are nervous to ask for testimonials. And you shouldn't be nervous to ask for testimonials, because, I mean, if you're doing a good job, which I believe the vast majority of programs are, then there's no stigma or shame in asking someone to then pay it forward. They might feel like it feels kind of crass to say, hey, would you write a Google review? Or it's like, no, you're helping the next person find the support that you receive. So that's one. And then, video testimonials that can be used for marketing. There's really no substitute for a powerful, authentic testimonial where people can talk about what life was like before, what it was like going through the program, and then what life is like after. Because again, people that are looking for quality programs, they're saying, well, how's it going to be for me? So the more people that they can see that say, oh, that looks like, that sounds like, that feels like me, they're much more likely to feel engaged to reach out.
Yeah.
I think, programs need to have written policies and documentation around this so that the alumni program is staying compliant. We would not allow people to share a story on our Heroes in Recovery site for 1 year post-discharge. So I think everybody's going to have certain best practices around that. It doesn't mean they couldn't participate in the events. We're just want to give them time before they shared a story. But there's a certain percentage that do want to share a story, just like there's a certain percentage that don't, and that's totally acceptable too and fine.
But you should still ask.
You want to support because because I'm a believer that for programs, anonymity doesn't mean secrecy. And so there's a way that you can blend that. You're going to have some people that want to go out there and they want to, we had a patient one time that got a tattoo with the logo. You're going to have, and that's fine. That's their choice. Wow. But you're also going to have other people that maybe only want to use their first name or want to be completely anonymous. And that's totally fine too. We want to respect all that. That's where having some documentation is helpful. And then having the different styles of events is just so important because you want to meet people. We say it all the time. Let's meet people where they are. Okay, well, let's do that in the alumni program too.
Right.
Right. And I think that you have to defend the spend, because you're going to face a point where somebody's going to come and say, well, why are we spending this money on this event or this? And that's where you've got to have the data that Jeff mentioned, because you will find that if you do track the data, it is a lower cost per admit, but it doesn't mean it's free. Mm-hmm. And so we have to understand that we have to support this. And I think that when you do that, that just further encourages that alumni community to also want to pitch in. So if we're the provider pitching in, they will meet you halfway and also pitch in, and now you've got this big multiplication effect.
Yeah.
Right, which is really, really critical.
Well, and I hope it goes without saying that, I mean, the data that we're speaking about, of course, goes towards supporting an alumni program, but it's also crucial towards your outcomes data. And so, I mean, the longer term outcome will only happen as you stay engaged with people that have graduated your program. So the longer you stay engaged with them, and not only are you building great, a high level of goodwill and all the good feelings and all that sort of stuff, you're also getting incredible data that will show how effective your program is when you want to negotiate with payers, when you want to be able to show how effective your program is. I mean, that's not the topic for today, but I mean, when we get to outcomes data and things like that, it's essential that you have information pre-discharge, pre-admission, admission, through the program, discharge, post-discharge, and then as long as possible so that you can show a long tail effect on what your program has done.
We had such a tight relationship between Selena, who led our research department, and Sabrina. So, they're doing their calls, right, for their studies on efficacy and outcomes, but they would know, oh wait, so and so is not signed up or involved in the alumni, and vice versa. The alumni is also reaching out, calling, and staying connected, and they could say, hey, you should be part of our research program. I mean, they can really work together, and then guess what? It was that data that was driving the outcomes that we would report when we were negotiating our payer contracts.
Right, exactly.
Yeah. I mean, it was amazing how it was so beneficial in so many ways.
Yeah, it's if you think about, I mean, to Lee's point, when he talks about defend the spend, when it comes to alumni, you have to pull back and actually see a much more virtuous cycle in terms of what the spend is on the front end to have somebody come into a program, the lifetime value that we're talking about, and then the outcomes, how that actually affects the negotiation that you have with payers. So it is a much larger cycle and a much larger circle than most people realize.
Lee, Jeff, man, this is such a powerful episode on alumni programs. Is there anything that I forgot to ask, or maybe that we missed on alumni programs that the listeners would want to hear?
I think if we get some comments, we could do another episode even on some, specifics. Yeah,
so I would love to hear.
The comments.
I would love to hear ideas from what people are doing that's really innovative and interesting, and so that
because we haven't even gotten into the apps that are available to stay connected, and what does that look like? I mean, there's so many tactics and specific things that we could probably dig into also.
Yeah, I mean, I guess what I would say is that people need to really sort of approach, if they have fear about an alumni program or if they're nervous about an alumni program, really be curious about what's causing that anxiety, what's causing that fear, and then step into that and then recognize the extreme benefit that's available to you if you'll confront what you think is, there are people that can help you figure out how to get through that anxiety and get to where this is really effective.
Yeah. Well, gentlemen, thank you for bringing it today. Awesome podcast. Really appreciate you guys and all your feedback on this topic. Very important. Thanks for joining today's episode of MasterMined. Please leave any questions you have in the comments or any topics you'd like to see discussed. Until next time, thanks for joining us on MasterMined.
That wraps up this episode of MasterMined. Thank you so much for joining us. And remember, MasterMined is not just a podcast, it's a community. So don't forget to comment, subscribe, and review us. Your feedback helps us continue to bring you content that's relevant and relatable. Thanks again to our sponsor, Snapshot, a digital media marketing agency. And thank you for joining us on MasterMined, your behavioral health playbook.